Hi, I'm Whitney and I'm a nurse practitioner student and I'm going to be doing a physical exam on my patient Kyle. Kyle initially came in with the chief complaint of nasal congestion and burning and some ear fullness, or the sensation that his ears were full, and a cough. Before he came into the room, I had him empty his bladder, I took his vital signs and his height and weight, and I had him put a gown on. I also had him do the distance vision with the Snellen chart. And now we're going to begin our exam. We'll start our exam with the head and face. So we'll start with inspection. I'm just going to be inspecting his head. I'm going to check for symmetry. I'm going to check for any lesions, any bumps that I can see just by visualizing his head. And then I'm going to move on to palpation. So I'm going to palpate his skull. I'm going to palpate the texture of his hair. And I'm going to move down his head here. I'm also going to palpate his facial bones, make sure he doesn't have any problems there, his nasal bone down into his jawbone. Okay, and I'm also going to have him do some cranial nerve exams. So we'll check cranial nerves 2 through 12. So if you can close your eyes, okay, if you can clench your teeth, you can open your eye. Can you stick out your tongue? Can you move it side to side? Can you lick your lips? Can you wrinkle your forehead? Okay. Can you puff out your cheeks? All right. So that proves that all of those are intact. I'm also going to palpate his TMJ. So if you could open your mouth and then close. I'm just feeling to see if I have any popping, cracking, or if that causes any pain. I'll also palpate his sinuses. So I'm going to start with his frontal. Move to his maxillary. Does this cause any pain?
Yep.
Okay. So noted that he has pain right here in his maxillary sinuses. And I'll also palpate his scalp to make sure it's movable on his forehead, or on his head. Okay, and next I'm going to test his light sensation. So I'm going to use a Q-tip here. So you feel what this feels like, correct?
Yep.
Now close your eyes and I want you to tell me if you feel it equally on both sides.
Yep. Yep. Yep.
Okay. Okay, so moving on, we'll move on to the eyes. So first I'll start with inspection. I'm just looking at his eyes, making sure they're symmetric. I'm also looking at to note the color, make sure that's equal in both eyes. Looking if you'll close your eyelids. On the outer eye, on the external eyelid, if he has any bumps, lumps, any kind of rashes, and I don't see anything there. So you can open your eyes again, and then I'm going to palpate his eyes. So if you'll close your eyes, I start with the external part of his eyelid and around his eyes. Okay, you can open, and I'm going to palpate his lacrimal apparatus right here. Okay, and check for any swelling. And I'm also going to be looking at his conjunctiva here and his sclera, which all appears to be normal. Next I will check his pupillary response. So if you'll look straight at me, I'm checking his consensual in his left eye, his consensual in his right eye, and then his non-consensual in his right eye, and his non-consensual in his left eye. All of that appears to be normal. Next I will check his 6 cardinal fields of gaze. So if you can stare straight ahead at me and move your eyes with my light, but not your head. Great. Next I'll have you cover your right eye. Okay. I'm going to focus on a point on the wall over there. I'm going to shine my eye in here, or the light at his left eye. Now uncover and make sure that his opposite pupil constricts as well. So we'll do it on the opposite side. Focus on an object. Okay, you may uncover. And yes, his opposite eye did constrict. Last thing we'll do with the eyes is move on to check his red reflex. So if you'll stare straight ahead at me again and turn this on. Okay. Great. So it's there, present in the right eye. Dial back up. Okay. And it's present in the left eye as well. All right, next we'll move on to inspect his ears. So again, I'm just going to have you look at me. I'm going to check to make sure that they're symmetric and that they're equal in alignment, and then I'm going to inspect the auricle, the outer ear on both sides. I don't see any drainage, any lumps, any bumps, rashes, scrapes, anything like that on the outer part of his ear. And then I'm going to palpate, so I'll palpate his outer ear or his auricle. Palpate this side. Okay, and I will do an otoscopic exam next to look at his inner ear. His landmarks are visible and it is pearly gray. Same thing on the left ear. Next I'm going to have him do the whisper test, so if you can lean forward a little bit. Okay, so I'm going to whisper something and I would like you to repeat what I whisper.
Apple. Orange.
This just assesses his hearing. You can lean back. And lastly, I would do a tuning fork exam to test his hearing. I don't have a tuning fork, so I'm just going to explain what I would do. I would strike the tuning fork and I would place it on the top of his head to test for the Weber test. And he's going to tell me if he hears equally in both ears. This tests his sensory neural hearing, and to make sure that he doesn't have conductive hearing loss. And then for the Rene test, I would strike the tuning fork, I place it on the back of his mastoid process, and he tells me when the sound disappears. And then I strike the fork, I do the same thing next to his ear, and he again tells me when the sound disappears. I record both times, how long it takes for them to disappear, and then I hope that the air conduction is twice as long as the bone conduction. Okay, that concludes the assessment of the ears. Let's move on to assess his nose. So we'll start with inspection. I look at his nose. I first assess his nasal bone. I'm looking at his nares, making sure that he's not having any nasal breathing, or you can see where his nares are flaring to suggest that he had a problem or some labored breathing. That all looks good. His nasal bone looks very straight. So next I will palpate his nasal bone. Yes, and that feels great as well. And I am going to look in his nose next and check his nasal mucosa, check his turbinates, and check his septum. So if you'll tip your head back. His nose does look a little bit red on both sides, and he's complaining of some burning in his nose, so that's probably why. If you'll cover your right nare, now breathe through the left side. Okay, again, do the other side. Okay, and both sides are patent. He does sound like he has a little bit of congestion with that, and that would be part of his chief complaint. Next we'll move on to assess his mouth. So if we'll start with his lips, make sure that they're not cracked, we see any lesions, all of that appears normal. So if you'll open your mouth, we're going to inspect his tonsils. If you'll say ah, okay, those appear to be good. We inspect his tongue. We look at his dentation. You can put your tongue back in. We look at his teeth all around. Okay, when you put your tongue up, look under his tongue. Look on the sides of his mouth here. I don't see any lesions anywhere. And I'm going to have him stick his tongue out, and we'll assess his gag reflex as well. So stick your tongue out, say ah. Okay, sorry about that. And that is present as well. Next we're going to move on to assess his lymph nodes. So we're going to start with the lymph nodes behind the ear, the post-auricular, the pre-auricular, the post-cervical, or the right by the occipital bone. And it assess under the jaw here. So the submandibular, the submental. Any of that causing you pain?
No.
And the tonsillar down here. And we'll just move down into his infraclavicular ones. So we assess right here along his collarbone. Okay, none of those appear to be enlarged, so that is a good sign. Okay, next we'll move on to the neck. So we'll just tip your head up a little bit, we'll look at his trachea, make sure that is midline. We'll look for any pulsating that we shouldn't see. We'll have him swallow. Okay, we can see that that is done properly. Now we'll do some range of motion exercises. If you can tip your head to the left, to the right, forward, backwards. Now against my resistance, same, forward and backwards. Okay, great. And we'll also palpate his trachea. So I'll have him sit here. You can swallow again. Good, okay. And I want to palpate his thyroid, or see if I can palpate his thyroid. So I'm going to move over here so I can stand behind him. Okay, so if you'll swallow. Good, and one more time. Okay, that's great. Another test you can do to assess his neck strength would be to do a shoulder shrug. So if you want to sit up and go ahead and shrug your shoulders. Perfect. Okay, now lean back. Next I want to listen or auscultate his carotid and his thyroid. So I'll take the bell of my stethoscope. Nope. Let me find my location by palpating first. Okay. So I know where I'm going on each side. Now listen at his thyroid as well. Both sides. I'm listening to make sure I don't hear any bruise, which I don't. And now I'm going to move on to his upper extremities. So if you'll stick your arms out for me. I'm looking at his arms and his hands. I look at the hair distribution. I'm going to look to make sure he doesn't have any rashes, any deformities that I can see. And then I'll move on to palpating. So I'll palpate the texture, the temperature, and the hair distribution again on both arms. I will look at his capillary refill and his nail beds. I'm going to palpate his radial pulse, his brachial pulse on both sides. Okay. Next I want to move on to the assessment of his back. So I'm going to have him turn away from me. So you can see on his back he does have a tattoo on his upper back and midline, and he also has a tattoo noted on his right triceps. His back, you can also see he has 2 scars from a surgery, correct, Kyle?
Yep. And
he has a scar midline at his vertebra, horizontal, and then another one horizontal right below his right shoulder blade. With his back, I'm looking at the hair distribution, I'm looking at the scars obviously, and I'm looking to see if I see any abnormal lumps, muscle mass problems, anything like that. So I'm going to palpate now. So I palpate his posterior chest wall. Any pain here, he would let me know. And next I'm going to palpate for tactile fremitus. So if you can say 99, Kyle.
99.
Again.
99.
Again.
99.
Again.
99.
And that's listening for any masses, consolidation in his lungs, anything that I would be concerned about if I could not feel the pulsations equally throughout his posterior back. Next I'm going to percuss for CVA, or costovertebral angle tenderness. So I place my hand here and I'm going to strike my hand over his kidneys. And no tenderness there?
Right.
Okay. Next I will move on to the lung assessment on the posterior side. So I'm going to assess respirations. You can see he's breathing about 12 per minute, which is a normal finding. They don't appear to be labored. And I want to next palpate for expansion. So I will place my hands at the bottom here of his diaphragm, or the bottom of his lung fields, and I want you to take a deep breath. In, out. I'm just making sure that my hands move symmetrically with the inhalation and the exhalation. All right. I'm also needing to percuss for diaphragmatic excursion. So I'll just do it on this side. What I'm going to do is have you take a deep breath. I note the change in tone. Let it out. And I would put a mark right there, and then go ahead and take a deep breath, let it out and hold. And I note the tone, change in tone there. I mark there, and then I take a measurement of that, and I want it to be between 3 and 5 centimeters. And same thing with the left side. I would do the exact same test. I also need to percuss in his lung field, so I'll start here at the top. Laterally. Okay, and I don't hear anything abnormal there. Next I will auscultate or listen to his lung sound. Deep breath. Again. 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 And again. Alright, all of that appears to sound normal as well. I lastly would like to check for some bronchophony, egophony, or whispered ventriloquy. So if you can say Mickey Mouse.
Mickey Mouse.
Again.
Mickey Mouse.
Again.
Mickey Mouse.
Again.
Mickey Mouse.
Okay, what I'm listening for is like a nasal quality. If I can hear him whispering, talking through my stethoscope, that means it would be, there could be a problem, or that's an abnormal finding. And I don't hear anything abnormal there. So next I'd like to inspect his anterior chest. So if you'll lay back down, and we'll take your gown down. Okay, so we'll start just by looking at his JVD, or his jugular venous distension. And he's at about a 45-degree angle now, so I'm looking here to see if I see any engorgement or enlargement of his jugular vein right here. And I don't see anything at all. We'll also inspect his anterior chest. So I'm looking on his chest for any thrills, any heaves, any abnormal masses, any labored breathing, and I don't see anything to note. And then I will move on to palpate his chest. So I'll just start by palpating his chest wall, or his muscle mass in his, or muscle in his chest. Okay, and I don't feel anything there, and I'm now feeling to see if I can feel any heaves or thrills or any pulsations. I will also palpate for his point of maximal impulse, which is his 5th intercostal space, the midclavicular line. And I feel it right here. Okay, I'm going to also palpate for tactile firmitus on his chest. So you can say 99.
99.
Again.
99.
Again.
99.
Checking again that the vibrations are equal throughout. And then I'm going to percuss his anterior chest. Laterally on both sides. Okay. Next I can move on to auscultating. And I will start with the breath sounds first. Deep breath. Deep breath. Again. Again. Laterally. Good. Okay. And then I can move on to the heart sounds. So I'm going to start with the aortic, which is the right 2nd intercostal space. The pulmonic, which is the left 2nd intercostal space. Erb's point, which is the 3rd intercostal space on the left. The tricuspid, which is the 4th intercostal space on the left. And the mitral, which is the 5th intercostal space on the left. Okay. So since we're in this region, I am also going to have him lift his arm here. We'll palpate his axillary lymph nodes. Don't feel anything there. Okay. So next we'll move on to the abdominal assessment. So I'm going to pull this down a little bit further, keep you covered. We'll start with inspection. So I'm looking for the contour, the hair distribution, any pulsations on his abdomen. Next I will auscultate his bowel sounds. I listen in all 4 quadrants. If I were to hear no bowel sounds, I would need to test for 5 minutes before I could say that there was an absent bowel sound. Next, I want to listen over his aorta. I changed to the bell of my stethoscope. I'm again listening for any bruits. And then I will listen at the renal arteries, the iliac arteries, and then the femoral. Okay. So next I move on to percussion of the abdomen. I expect to hear a different tone over the solid organs that I hear over the colon. I hear dullness over the spleen. Okay, and then I'm going to move on to palpation. So I'll start with light palpation. Let me know if this causes any pain. I'll move on to deep palpation. And then I want to palpate the liver. So I'll have you take a deep breath. Okay, and then the right kidney. You can let your breath out. I'm going to move on to the spleen. Take a deep breath. Okay, and then the left kidney. Great. So I don't feel anything there. Then I can percuss the liver borders if I want. I would go down until I hear a change in tone. I expect it to be right below the costal margin. And same thing up here. And then I would measure between, and I'm expecting it to be between 6 and 12 centimeters. Okay, next let's move on to the feet and legs. So I'm going to start just by inspecting his hair growth, look for any rashes, bumps, bruises, lesions, anything like that. And then I can palpate. So I'll palpate the skin texture. I'm going to look for any edema. I will be feeling for that as well. Check his capillary refill in his toes. I'm going to palpate his dorsal pedis pulse on both sides. His posterior tibialis pulse, both sides. And his popliteal pulse. I also will be feeling his muscle mass as I'm moving down his leg to make sure it's equal on both sides. Next I want to do some assessment of his musculoskeletal system, so I'm going to have him swing his legs off that side. Okay, so again I want to have him use his strength, so I have you kick up against my hand on both sides. Now the right side. Okay, great. Now push down with your toes. Now pull up with your toes. Okay, now pull back. Okay, great. Now pull out against my hands. Okay. Now I'm going to assess his reflexes, so I will do his knee reflex, or popliteal, both sides, his Achilles, both sides, and I will do his brachial. Okay? Good. Now if you'll stick your arms out for me, push up against my hand, pull down. Okay, out in front of you, same thing, push up, pull down. That's assessing his deltoid strength. We will also have you stand up, and we'll assess his quadriceps strength by squatting. So if you'll squat down, okay, and squat back up. While we're here, we'll assess his spine. So if you can bend forward, I will be looking at his spine, the cervical, the thoracic, the lumbar, making sure there's no scoliosis, kyphosis, lordosis. Okay, you can stand up. And you can sit back down, and you can swing your legs over there if you want. The last thing I would like to test is his sensation, so I will use my okay, now you feel how this is sharp? This is dull. Okay, now close your eyes and I'm going to assess. We'll start here.
Low. Sharp. Low. Low. Sharp.
Okay, we'll move to the left leg.
Low. Sharp. Low. Sharp. Low.
Okay, we'll move to the arms. Continue to keep your eyes closed.
Sharp. Low. Sharp. Low. Sharp. Low. Sharp.
Okay. This concludes my exam with my patient Kyle.